Chapter 9 Health Profession Education Research Methods and Tools. Moner H. Maud Al Sheikh. Abstract. In contrast with research in biomedical science, health profession education research addresses different types of research questions. The question may involve comparing the efficacy of two teaching or assessment methods, assessing an educational practice, or exploring a new method. This leads the need for a wide range of methods classified under quantitative, qualitative, and mixed methods. This chapter gives an overview of methods and gives an overview of toolbox for the researchers to address their research questions in an effective manner. Most popularly used quantitative methods are experimental, quasi-experimental, testing, observation, correlational studies, and surveys. The tools used are questionnaires, tests, checklists, rating scales, observation schedules. Most popularly used qualitative approaches. Methods are grounded theories, ethnography, phenomenology, action research, and case studies. Focused group discussion, in-depth interviews, document analysis, narratives, and even social media. The methods used should be aligned with the research question and they should be evidence-based. Key words: educational research, research tools, qualitative research, quantitative research, research methods, critical appraisal. Assess need. Health profession education research is a rapidly growing field that is born out of an effective application of scientific research methods to answer questions faced by health profession educators in their diverse settings. It also helps in exploring new teaching, assessment methods, new curriculum designs, and evaluation. Once a problem is identified, the next question is how one can go about to resolve the research question. The use of the appropriate method and tool for measurement or description becomes a matter of vital importance. HPER can be quantitative, qualitative, or mixed. Quantitative studies test hypotheses and typically address questions what works, while qualitative studies are more exploratory and allow for probing into quantitative results to find out the reason behind them to generate hypotheses and answer the question of whether, how, and why something works. Quantitative studies can be descriptive, measurement, or interventional, while qualitative can be descriptive or exploratory. Each of these approaches to educational research is useful on its own and is even more productive when used as complementary. There is a toolbox for each category of HPER and quality indicators. Tests, surveys, checklists, rating scales are quantitative tools as they deal with measurement using statistics, while focus groups, personal interviews, Delphi technique are qualitative tools for capturing data in words. While books in education give pure educational examples, this chapter will use examples from the HPER world to illustrate each of the highlighted issues. Brief. Health profession education research is unique in its application of a quantitative approach which deals with numbers, B qualitative approach which deals words, expressions, and C mixed methods research combining quantitative and qualitative methods. Most popularly used quantitative methods are experimental, quasi-experimental, testing, observation, correlational studies, and surveys. The tools used under quantitative approach are questionnaires, pretests, post-its, checklists, rating scales, observation schedules, etc. Most popularly used qualitative approaches, methods are grounded theories, ethnography, phenomenology, action research, and case studies. Qualitative research, being explorative, uses a variety of tools and techniques. Focus group discussion, in-depth interviews, document analysis, narratives, and even social media. The methods used should be aligned with the research question and should be evidence-based. CO and 3XTUARIZE. Scenario 1. You are the head of medical education department in a medical school that has adopted a parallel integrated, problem-based learning program in addition to the traditional curriculum. The dean of the medical school has requested you to compare the educational environment in the two programs from students' perspective and to prepare a report for the Ministry of Education. The research question was, what is the student's perception of the PBL and traditional educational environment for medicine? In order to answer this question, you need to choose a tool. You can choose DREEM as a tool to measure students' perceptions of the educational environment. The DREEM is a validated 50-item questionnaire, each of 5-point Likert scale. It measures students' perceptions of 5 subscales, namely learning, teachers, academic self, social, and atmosphere. The method you selected was quantitative research design and the tool was DREEM. Suppose the results are in favor of the PBL curriculum, but the DEN asks you why the PBL curriculum is perceived superior to traditional by students. Now you need to select qualitative research design to answer that question. So you select a stratified sample of students from PBL and another one from traditional program and you use the focus group tool. The scenario reveals that the choice of the method or tool depends upon the research question besides other factors such as feasibility in terms of time and cost. Describe quantitative methods. Most popularly used quantitative methods are experimental, quasi-experimental, testing, observation, correlational studies, and surveys. Experimental, quasi-experimental. Experimental design. The experimental method is the only method of research that can truly test hypotheses concerning cause and effect relationships. It represents the most valid approach to the solution of educational problems, both practical and theoretical, and to the advancement of education as a science. It requires complete randomization of the groups involved and double blinding of subjects and observers. This is not always feasible in educational research. For example, if you are interested in finding out if adding a simulation component to training nursing students on Leopold maneuver, your experimental design should include two groups. One receives theoretic instruction, then goes immediately to practice on patients in the wards, and the other group takes after theory a simulation session on mannequins before practicing on real pregnant ladies. Then you compare the performance levels of the two groups at the end of training. Complete randomization of students and controlling all other factors like the instructor, time of instruction, academic level of participating students in each group are characteristics of a true experimental design. Experimental design leads to powerful evidence of cause and effect relationship, but it is not always feasible as these students are usually allocated in groups from the beginning of the academic year. So you resort to quasi-experimental design, which allows you to keep students in their respective groups and still perform the study. So the difference between the two methods is summarized as follows. In a true experiment, subjects are randomly assigned to either the experimental or the control group, whereas there is no randomization in a quasi-experiment. This makes experimental design more internally valid. In a quasi-experiment, both groups differ not only in terms of the intervention like teaching method or mode of instruction they receive, but also in other factors like the instructor, timing of instruction, baseline academic level of subjects. Additional statistical methods are needed in a quasi-experiment to cancel the effect of any confounding variable. Because complete randomization is lacking in quasi-experiments, there may be several competing hypotheses to explain the difference in the outcome of the two groups. It is generally hard and most of the times not feasible to maintain internal and external validity in social science research. The tools under quantitative methods. The tools used under quantitative approach are questionnaires, pretests, post-its, checklists, rating scales, observation schedules, etc. Testing. Tests are commonly used in quantitative research to measure attitudes, personalities, self-perceptions, aptitude, and performance of research participants. They can include single or multiple item formats which aligns with the purpose of the measurement. Survey or questionnaire, a self-report data collection tool that allows research participants to express their information about the thoughts, feelings, attitudes, beliefs, values, or perceptions about a particular research objectivity is a list of statements designed by the researcher to measure degree of agreement of a sample of respondents to these items. Statements should be stating facts or opinions and should not be in question format. The subjects are requested to respond by either yes, no, or by selecting their level of agreement on a 3-point to 9-point Likert scale. Surveys are good to measure perceptions of subjects of specific items and should undergo validity and reliability measurement. Surveys can cover a wide selection of topics from learning preferences and styles to satisfaction measures. They are particularly useful for determining perceptions and attitudes of a large sample towards a particular issue at a particular time. Surveys are criticized for relying on personal judgment, which is not always accurate. It is preferable to have an even number of levels of agreement and to exclude neutral from the choices. Surveys can be used for screening purposes to find people with specific characteristics to include them in the qualitative in-depth study. Response rate should be reported as the percentage of responses received over the total surveys sent and should not be less than 60%. Lower response rates are associated with low reliability scores. Informed consent, confidentiality, and anonymity are important ethical considerations of surveys. There are 15 principles for using questionnaires in educational research. Questionnaires can be used as a qualitative tool when the questions are open-ended. In the example of the educational environment measurement, following the 50-item 5-point Likert scale questionnaire, students were given 3 open-ended questions that said, A. Mention the best course activity you had in the college so far. Mention the worst course activity in your college so far. C. Why do you think it was so? Answers to these simple 3 questions shed light into the students' experiences and overall perception of their undergraduate experience. Checklists, rating scales, observation schedules. Checklists, they are lists of performance categories that candidates are evaluated for by a check if available. The major weakness of checklists is that they are dichotomous and only informs if the candidate did or did not do a certain behavior. A rating scale, on the other hand, gives levels of performance for each behavior category and is much more indicative of skill acquirement or mastery of a certain procedure. For example, during the OSPE examination of second-year medical students, the instructor evaluates students on their skill in measurement of heart rate using recordings of pulse rate on a physiograph. If the observer uses a checklist, the findings are reduced to mere recording of whether the student chose the correct transducer, attached it to the physiograph, performed the recording, and calculated the heart rate. It misses information of how many trials and errors the student did in order to obtain the required record. It ignores completely how skillful the student was in fixing the transducer to the machine and to the finger of the subject, and so on. There were incidents when a student was very confident in choosing the proper transducer, fixing it to the physiograph, and elegantly getting the record or calculation, as opposed to another who clumsily tries 2 or 3 wrong transducers before reaching the correct one, tries to fix it in the wrong direction to the physiograph, and uses force to do that, drops the transducer to the floor and picks it up after almost breaking it, and hesitantly obtain the ECG record and calculation. Both candidates will get the same score if the tool is a checklist. Using rating scale, the observer has more space to reflect on the difference in the level of performance between the 2 candidates. Checklists can be enhanced by a global rating at the end of 3 to 7 levels to record the subjective evaluation by the observer of the candidate's performance. Observation is defined as watching a behavioral pattern. It is a standard process to obtain reliable research data. It involves standardization of the observer observed and the context as in the location of the observation, timing, and duration. The results of observations are usually in the forms of counts of the frequency of a certain behavior was attempted or a score that evaluates that behavior. Observations differ from questionnaires as the former records behavior while the second captures attitude. Observations are time and money consuming. Subjects can behave differently when they know they are observed. They can be made in a simulated environment like OSCE, OSPE, or in the natural world like workplace-based assessment or mini CEX. Blind observation in a natural world is more reliable. The pre-post test. This is the most commonly used quantitative experimental tool. The purpose of this tool is to measure the cognitive growth after an intervention. It is loaded with confounding variables as it is very difficult to assume that the change in the learner's knowledge or skill is solely due to the intervention. To avoid this dilemma, the use of two groups randomized controlled trials erupted. The issues of dilution or spread of intervention from one group to the other and blinding should be addressed. This is what distinguishes educational research from clinical and scientific research where the subjects are under direct control of the researcher. Tests can measure performance in knowledge, clinical reasoning, intelligence, personality, or empathy. Achievement tests are designed by teachers to measure learning over a period, while aptitude tests measure the ability to learn or schemata formation. Diagnostic tests are designed if a student is qualitative methods. Most popularly used qualitative approaches methods are grounded theories, ethnography, phenomenology, action research, and case studies. Grounded theory, a qualitative approach to generating and developing a theory from the narrative data that the researcher collects. It uses an inductive approach for generating theories or explanations. It is the study of a concept and not the description of a problem. Ethnography. Ethnography is a type of qualitative research that collects observations, interviews, and narrative data to describe an educational phenomenon. It is a research tool where the first-hand reflections of a participant on his experiences about a certain phenomenon in education as related to cultural settings. Phenomenology is a methodological endeavor performed by professional educators. In this tool, the researcher personally experiences the phenomena under investigation and later reflects deeply on that experience. The relation between phenomenology and educational research is the characterization of educational situations and in the logic of educational practices. In phenomenology, the researcher first documents an experience of the research in question, then progresses through 5 phases of the methodology to reach an answer to the research question. It is a useful tool to portray knowledge about first-person events or the lived experiences of students in certain educational contexts. Action research. The researcher here plays an active role in changing the outcome of the research question. He seeks transformative change through the simultaneous process of taking action and doing research, which are linked together by critical reflection. In other words, action research is a form of problem-based investigation by educationists into their teaching, thus it is a process. It combines the concepts of human nature and action science and cooperative inquiry to obtain actual change in behavior as a result of corrective actions. Case studies. Robert E. Stick defines case study as the study of the particularity and complexity of a single case, coming to understand its activity within important circumstances. It gives a holistic view of the context of an experience in education. The rich details that accompany case studies makes it a useful tool for educational research. Case studies are useful as a preliminary research that provides data about the scope of data collection and sets the stage for future more comprehensive research. Data collection and analysis in case studies is time consuming and there is high risk of researcher's bias. Lack of generalizability and extrapolation power of the evidence is another weakness. The tools under qualitative methods. Qualitative research, being explorative, uses a variety of tools and techniques: focus group discussion, in-depth interviews, document analysis, narratives, and even social media. Focus group discussion. Focus group discussion is an effective method of investigating a research question that addresses what people think about a particular phenomenon, why they think so, expressed in their own words and gestures. For some researchers, any discussion in which the participants are actively engaged and attentive in group interaction becomes an FGD. Focus groups are normally of 4 to 12 candidates, and the researcher acts as a facilitator to guide a relevant discussion to the research question. The group is carefully selected to have common features, for example, students of the same level, gender, or learning strategy. They are particularly useful to probe for answers why a particular measurement was found or to propose solutions to a problem. It is a dynamic, interactive data collection method that can explore into attitudes, underlying assumptions, or causes of certain behaviors. Focus groups are semi-structured and are recorded and coded for analysis of responses. They are criticized for being not suitable for private matters. Another disadvantage is that an influential candidate can change the opinion of the whole group. Interview. One of the most important tools in qualitative research is the qualitative interview. It can be categorized into unstructured, semi-structured, and structured. The most important part in interviews is to identify the key informants considering their knowledge, role, or willingness. In unstructured interviews, the researchers ask questions as they emerge to explore the meaning of a certain behavior or observation. Semi-structured in-depth interviews are the most widely used tool for qualitative medical education research and can be either with a single person or with a group. Typically, an interview takes half an hour to several hours and is face-to-face, but telephone and email interviews have also been used. Individual interviews allow for probing into private issues, while group interviews give a wider perspective. The responses of each interviewee are recorded in addition to the group dynamics and interpersonal interaction. The analysis of interview data has been described elsewhere in this book. It can be supported by photos or videos of the interviewees. Observation notes. Researchers opt for these records or field notes to study how students perform or act in certain situations rather than what they think or say they do. Field notes are structured to include the content, context, and audience, and may include audio recording of spontaneous conversations. Observations are criticized for being influenced by the presence of the observer. This can be minimized by obscuring the purpose and research objective from candidates and by ensuring passivity of the observer. It is a useful tool for common events but not for rare incidences. Lupton describes the use of social media in qualitative research. There is increasing interest in the use of blogs and social media like Facebook, Twitter, Telegram, and WhatsApp. Document analysis, narratives, and social media. Narrative inquiry is a research tool that collects qualitative descriptions to reach a conclusion about the research question. It is a reliable tool to measure performance and has been used to evaluate neurology residents. Narrative inquiry used to detect professional identity roles. In the latter study, deconstructing the narrations provided by participants helped recognize their professional identities, their views and assumptions, and thus provided them with rich feedback. Confidentiality of participants is a concern in this type of research. The combined use of visual narratives has been used to study and record behavior of preschool children in daycare. One should realize that the selection of methods and tools largely depend upon the research question. For example, if the research question involves how students perceive integrity and professional behavior or how they would behave in an ethical dilemma, then interview would be the most suitable tool. Alternatively, if the research topic is about medical errors and how students perceive malpractice, then focus group is a better tool as similar experiences of other students help candidates crystallize their thoughts. If the research question is about residents' reaction to criticism of their diagnosis, and management in the morning report, then observation notes of morning reports will be the best data collection tool. Mixed methods can enrich the findings of either one alone and can accomplish a methodologically rigorous study design and lead to rich and comprehensive findings. Summarize. The table below gives us summary tools and methods for educational research. Evaluate. You are the Vice Dean of Academic Affairs at an established medical school. Graduates of medical schools in your country set for a medical licensure exam as soon as they graduate in order to be allowed to practice or enroll for postgraduate training. The Dean requested you to evaluate student performance in the MLE over the years. The research question was, what is the trend of students' performance in MLE? If it has declined, why the students' performance in MLE has declined over the years? And to prepare an improvement plan, which method will you suggest? Road ahead. Research in health professionals education requires several successive steps, from formulating the correct research question to deciding the method for dissemination of the results. Each step has its own importance. One of the key steps is choosing the correct method for the research. Each approach has advantages and disadvantages and should be chosen according to the question being asked and the specific goal of the study. The road ahead should aim at well-conducted education research using the appropriate methods and tools that allow progression towards the important goal of using evidence-based education in our teaching institutions. Identifying priorities for research efforts, selecting the appropriate tools and methods for the same, and engaging a range of stakeholders in research priority setting exercises has been posited as an effective triad leading to the road towards reducing researcher bias and increasing social accountability.